medication? And you're just taking testosterone? Okay, you don't smoke?
I'm working with Dr. Lynn.
Okay.
He's kind of the boss. This is assortment of us. This is Amy. And then this is our scribe. He's here to describe the situation. Bad pun. I was just coming in here, getting to know you, learning about your history, kind of going through all that stuff. And then he's going to come in here and talk about the surgery. And I assume you're here for the top surgery. And I've got some pictures I can kind of show you that kind of describe what it would look like and how things would heal and incisions and stuff like that. First off, welcome. What is your preferred name?
Just call me Alex.
Alex? Okay, perfect. And you're 20 years old, is that right? Okay. Any medical problems?
No.
Okay. Have you ever had surgery before?
Yeah, I had my tonsils out about a year ago.
And did the anesthesia go okay with that?
He had a little bit of a problem waking up because he had never been under anesthesia before.
Okay.
So.
But no complications or
No,
anything?
no.
Just, okay.
Everything was good other than just waking up from it took a little bit
I'm
longer.
a crybaby.
Okay.
I cry.
That's alright. So do I. Do you smoke?
No.
Drink?
No.
Any party drugs?
No.
Okay. No. That's good. Where do you live?
In Berea.
Berea?
Yep.
And what do you do for a living? Student/working?
Yeah. Well, I work at Walmart.
Okay. And support system. Who is this with you? And
This is my girlfriend.
okay. Nice to meet you.
Me too.
And well, after the surgery, she'll be helping you and stuff like that. Okay, so you've got someone that could help. Like, just generally after, you're not supposed to do any heavy lifting, nothing greater than 5 pounds for at least 4 weeks, just to let things heal. And that'll be like groceries and like driving you around, especially if you're taking pain medicine, that kind of thing. Family history. Any family history of breast cancer that you know of?
Don't think so.
Okay. And medications. Let's go through that. You're doing the testosterone?
Mm-hmm.
How long have you been doing the testosterone?
November makes 2 years.
2 years. Okay. And who manages that?
Oh gosh, she's new. Her name's Rachel.
She
Get on the phone.
endocrinologist?
Yeah.
Okay.
She just took over, so she's
Here at UK or where?
Yeah.
Yes.
At Barnstable and Brown on Harrodsburg.
Okay. Okay, great. And how long have you identified with your gender?
Let's see. I've been on testosterone for almost 2 years, but really since my freshman year of high school, I guess.
So you'd say like, 6 years?
Yeah.
Gosh, I'm terrible at math. Okay, so as long as it's been more than a year is kind of what I was looking for.
Yeah.
And then have you, like, sometimes in terms of playing the insurance game, they like therapists that kind of just, do you have like a letter from a therapist?
I will, yeah.
Okay, perfect. Because that's usually, it's like we'll have to do pictures and then like a therapist note. And also the fact that you've done endocrine for more than a year is just all like a game in terms of check boxes that they like to.
Right.
All right, that sounds good. Do you have any ideas or questions that I can answer her to?
Not really.
Okay. Can we get you in a gown just to kind of, I don't think you need to take your pants off, but at least so we can see the top part. Because there's 2 different kind of techniques in terms of doing the procedure. and it kind of helps us to get an idea. And you'll have to do pictures if you're okay with it. It won't have your head in it. It's just like top of, basically from neck to down here. And so, do you have a particular idea of what style sometimes?
I don't really want, what is it called?
The keyhole?
Yeah, that one.
You want that one or don't
I
want?
don't want that one.
Okay, gotcha.
I don't want to have to be back for like revisions or anything.
Okay, gotcha. All right, well that sounds good. Well, so at least the one that we were talking about would have like kind of an incision, kind of where the kind of like outlines the pec, your pec, and we would take your nipple off, make it a little bit smaller, and kind of fit kind of just right around that incision. And that'll be kind of a we call it a graft when we take the nipple, shorten it, and then put it back on. So usually you'll have like a dressing that kind of holds that graft on in place, and then it's usually for like a week. We'll take it down, and then you just do a light dressing to it, and then just take it easy. Usually you'll have to have a drain on each side just because with the testosterone, he'll even talk to you about stopping that a month prior to. You still have the changes like increased blood flow, and there's tend to be a risk of developing like a hematoma, which is just bleeding underneath the skin. So that's the reason why we put the drains there. But usually those come out within a week or so. Okay. All right. Well, I'll be right back.
Hi there.
Hey.
How you doing?
Good.
I'm Dr. Lynn. It's Alex, right?
Yeah.
Nice to meet you. Hello, how are you?
Nice to meet you.
Nice to meet you too. So you're interested in seeing us about top surgery, is that right?
Mhm.
Good, good. You've come to the right place. So we find that the hardest part of the surgery is getting your insurance to approve it.
Yeah, I've heard.
So that's something that we can start working on right away. It may take a little while. And of course, you always have the option of paying for it on your own, and we have the prices for that. They're not, the same prices as if, you go to your insurance, because we try to make it a little bit easier for you to pay out of pocket. But if we can get your insurance to go for it, then that would be clearly the best thing for us, okay? In order to do that, a lot of them require several things. One is they require some kind of either an ultrasound or a mammogram. Number two is they require that you have some form of a mental health care professional letter that kind of, confirms the diagnosis. And then number three is they actually ask for some period of time on testosterone. And those typically are the ones that most of them will ask. If you have a specific kind of insurance, and sometimes they may even add on something, and we just have to kind of work our way through that, okay? So I can tell you a little bit about the procedure, and I've got a booklet there of all the patients, not all of them, but some of the patients that I've done, and so you can kind of get an idea of what what to expect, okay? Have you ever had any suspicious lesions or lumps or bumps in your breast at all? Is there any history of breast cancer in your family with your mother or sisters or anything like that?
No.
Good, good. I'm gathering you've never had a mammogram.
Nope.
Okay. And you've been on testosterone for what, 2 years now?
Almost two.
Good. Do you go through the Transform Clinic here with Dr. Fallon Bennett?
No.
No. Okay. We have our own clinic here, and she is the medical director of that. So I see a lot of patients that work with her, and then when they finally get to the point where they're ready to have surgery, then they send them to me. Okay. We used to have both top and bottom surgery, but our urologist has taken a new job up in Cleveland, so we're waiting to replace him with somebody else. But I find that most people just want top surgery, and then they kind of stop at that.
Yeah.
There's a few people that go all the way, but they're not as common, let's put it that way. All right, I'm sure you've done a lot of reading about it, all right? And so you know that there's a couple of ways that we normally do this. One is called the keyhole pattern method, and the other one is sort of the double incision. I base my decision about which I recommend based on how much skin there is. Because if we remove the breast tissue and we don't remove the skin, then you'll have all this floppy looking skin here. And if you have too much of it, it won't look good, okay? Men have breasts, so we don't remove all of the breast tissue. We remove maybe 85 to 90% of it. But I think if we did a true mastectomy, like we do for somebody who has breast cancer, it wouldn't look right. It would look hollow and kind of caved in, and that's not what we want. Okay, so so it will depend. Also, it depends on how large your nipples are, because men's nipples are substantially smaller in general, and so I think that is something that we would use to determine which method is best suited for you. Okay. The surgery is done as an outpatient. You come in, you have it done, you go home usually the same day, depending on how far away you have to drive. You know, if it's a 5 or 6 hour drive, then maybe staying overnight in a hotel somewhere might be, helpful. You'll feel better the next day for sure, and if there's any problems, you'll be right there. So, you can always come back and see me. Very rarely do we have any problems, but if we are going to have some problems, it's usually from bleeding. And we put in these little rubber drains, they're little tubes that suck out fluid, and they will initially be somewhat bloody, but after a while they'll turn into sort of a clear liquid or a straw-colored liquid. Okay? And those drains usually stay in until, the first visit, which would probably be like a week. Okay? Any questions so far about any of that?
No.
Okay, cool. So I haven't told you anything new?
No.
All right, good. All right, why don't you step on down? Let me take a look at you here. You are fairly close to being able to do the keyhole, but I think that if it didn't shrink up for you, then you'd have to have some additional surgery done. Maybe the best way, if you don't mind the scars, is to do the double incision. Your nipples are not that big in terms of having to reduce them, but I think that your skin is probably just right on the border of being a little bit too much. I usually reserve that option for somebody who's like truly an A cup, and I think yours is maybe sort of closer to a small B. So that's why I think maybe in your situation, especially if you wanted to make sure you got the best result with just one operation without having to have any kind of adjustments or revisions or anything like that, probably that would be the best way to go. Okay, so we'll show you the photograph so you can kind of see. Most of the people that I've been doing on are significantly larger, so you'll see that in the pictures there. But I think that you'll get an idea at least of where the scars are. Your scars will be more limited because lots of people who have larger breasts will have a lot of tissue underneath here. And so in order to get that, sometimes I have to extend the incision out there to get that, because otherwise it just kind of looks funny to have a roll out here. But you don't have that problem, okay? So, so really then it's just a matter of trying to get your insurance on board, and we can go ahead and get at least the mammogram ordered for you. And then we'll need to kind of compile a letter from your from your healthcare, your mental health care provider, and the testosterone you already kind of fit into that. Now, testosterone is very good at suppressing your natural estrogens, and because you're going to have some breast tissue left over, it will be important that you maintain that. Because if you don't, then your natural estrogens will come out, and then it'll cause maybe even the breast tissue to get a little bit larger since we're leaving some behind. But testosterone also may cause a little extra bleeding. So what we try to do is get people to stop the testosterone, usually about 3 to 4 weeks before we do the surgery. And then we do the surgery, we let the healing happen, and then you can get back on the testosterone again. But it's just a short period of time where we actually want you to be off of it, okay? Are you on any other medications at all? Okay, good. Some people get a little confused and they stop all of their medications. All I really need you to do is stop the testosterone, okay? All right, I think that's pretty much all I need to tell you about, unless you have some questions for me. No? All right. One thing that we will do is ask you to have some pictures taken so that I can add them to my collection, and then you'll be able to see what you look like afterwards, so when you finish the whole thing, you can kind of go, oh yeah, that's how I used to look, and then I look differently, okay? All right, so let's go ahead and why don't you show them the pictures, then you'll get some pictures taken, and then you can go ahead and get dressed, and we'll get that all ordered for them,
Yep.
all right?
Okay.
All right, where do you live?
Berea.
Oh, that's not that far away. Right. Good.
And we'll order I think it's usually an ultrasound, but we'll order that.
Check with Patty, because she'll look at his insurance and see sometimes.
Okay.
I think it's mostly a mammogram, actually.
Okay.
Okay.
All right. Sounds
All right, so nice to meet you. I think we'll be able to help you. Nice to meet you too.
Nice to meet you.
All right. And if you have any other questions, please let me know.
All right.
Okay? All right.